Hello, and thank you for joining our presentation on B12 Deficiency, the Silent Epidemic. I'm Heather Schofield, homeopath and medical educational director with Biomed, and here with me is Harlan Lahti, pharmacist, owner and founder of Finlandia Natural Health Center and Pharmacy, and chairman of Biomed International. Harlan has joined us today to speak on vitamin B12. Specifically, he's going to be focusing on the benefits of vitamin B12 and talking about the differences between methylcobalamin, cyanocobalamin, and information that surrounds this whole thing, like who should be taking B12 supplements, the reasons why we should be taking B12 supplements, and the benefits of B12 supplements. So, who needs vitamin B12?
Good morning, Heather. This is one of my favorite topics. The B12 is really very poorly understood, I think, by the medical profession. Who needs it? Well, pretty well everybody. The ones that are at high risk are, of course, people over 45 and the elderly, but the vegetarians as well, because if you understand that B12, the main source is meat, and our world is moving gradually towards vegetarianism, so this is going to be a greater and greater problem as we go along and more people switching to vegetables. There is no vegetarian source of B12. So the other area that causes B12 problems are the taking of some medications, specifically the medications of the acid blockers, or people who are anemic, or people with low stomach acid. Now, a huge number of people have low stomach acid, so they are simply not absorbing the B12s that they do even get in their red meats. So consuming alcohol, diabetic drugs, and digestive problems all lead to B12 deficiencies. And this is a bit of a shocking statistic that 50% of adults are deficient in B12, and 1 in 2 adults are low in B12. So this is a huge number of people that are really going unnoticed. And a lot of the B12 deficiency symptoms are being treated by medications because simply the physicians aren't thinking about it. Is this a B12 deficiency or is there a real problem?
When we're talking about absorption, there's the information about cyanocobalamin versus methylcobalamin, and methylcobalamin in the sublingual form is a superior absorption component. Can you talk on that? Correct.
Okay, the main source of vitamin B12 in your supplements is cyanocobalamin. Now, this is the cheapest. Of course, that's why it's there, and it's really cosmetic because cyanocobalamin is not absorbed without intrinsic factor. It's 50% absorbed with intrinsic factor, but you don't see intrinsic factor in any of the normal daily vitamins. So essentially, they're putting B12 in there as a cosmetic effect because it's simply not absorbed. It's one of the main sources that they also use for injectables. But there are 2 other sources of B12, which is hydroxycobalamin, which is actually the most active and beneficial source of B12 for injectables. And then there's the methylcobalamin, which we are using in our supplement. Methylcobalamin is well absorbed in the mucous membranes. There's been a number of products earlier that they actually put it into a nose spray. So whether it's under the tongue, in the mouth, up the nose, it's a very well absorbed vitamin form of the B12. It's also one of the more expensive ones, so you will not generally see methyl B12 in the daily vitamins. Even if you take the methyl B12 and it's in a supplement where you're swallowing a pill, it's not absorbed well in the stomach.
Can you explain how sublingual methylcobalamin works, in why sublingual, and how is that the form of absorption?
Well, it actually crosses the blood barrier right under the tongue. There's a lot of vascularization right in the mucosa, and it's a form that simply goes across the mucous membranes very quickly and very easily. That's why it's also very good in the nose.
Okay. Can you tell us what some of the benefits of B12 are and what it does for the body?
Well, the main benefit, of course, it's our big protective vitamin, and I forgot to mention it's an essential vitamin, so we cannot get along without this vitamin. When we don't have it, then our nervous system, basically, and certainly the brain start to suffer, and they suffer very quickly. It prevents cognitive decline, and we can't go out and say it's going to prevent Alzheimer's because there's other reasons, but cognitive decline all are a precursor of Alzheimer's. So diabetics particularly need this to protect the peripheral nervous system. So in many cases with diabetics, they get burning feet or burning extremities. Now this is almost a symptom of lack of B12, and they respond very quickly to this. In this case, with diabetics, of course, it may take a month of the therapeutic dose of this product to reverse that.
Now, when they're talking about dosage, often it's recommended 1,000 micrograms a day. However, Optimum B12 F has a potency of 5,000 micrograms a day. Why would one want to take 5,000 micrograms daily?
Well, it's probably not necessary to take this daily. So, if you're taking 5,000 a day, for one thing, there's no problem with overdose. So it's not like vitamin D where you have too much, it's a problem. But I would recommend the daily maintenance dose for this to be 3 tablets a week. So you wouldn't have to get, and if there's some concern about even the digestion in the mucous membranes, remember you're giving 5, and if some people have compromised mucous membranes, you know that they're going to be getting 2 or 3. So we're giving a very good, almost therapeutic dose with this, certainly if you're giving it every day. Now, if a person has been tested and they're therapeutically deficient, of course, the dose is 15,000, in other words, 3 tablets a day for a month. And this would be a diabetic person with exhibiting the symptoms of burning feet, for example.
There's research out there showing that sublingual methylcobalamin can be as effective as B12 injections. In addition, I know there are many patients out there that need to take B12 injections. For example, in Crohn's disease, they're not able to absorb the vitamin B12 from their food. So can you speak on sublingual methylcobalamin versus B12 injections?
Well, for one thing, they both go straight pretty well into the bloodstream. Whether it's through a needle, the passing through the mucous membranes basically doesn't go into the liver, it goes right into the bloodstream. So the effectiveness is really about the same. And the methylcobalamin as well, we won't go into the chemistry, but it's also a methyl donor. And this is a very positive aspect of the methylcobalamin.
Okay. And I have one final question. The Biomed product, Optimum B12 F, is a combination of vitamin B12 and folic acid. Can you explain why there is a big benefit for taking B12 and folic acid together?
Well, absolutely, because there's 2 types of anemia. And of course, folic acid, lack of folic acid will cover up the B12 deficiency in a certain type of, so if we're putting the folic acid and B12 together, they work like brother and sisters in the same family because they are getting at all the possibilities of anemia.
Excellent. Well, Harlan, do you have anything else that you would like to add about vitamin B12 or the B12 deficiency, the silent epidemic?
Well, the particular product that Biomed has is a very nice product. If you'll compare what's out in the marketplace, it dissolves very quickly. It has an absolutely delicious taste as a lozenge, and the benefit of the folic acid with it together. It's a hard-to-beat product, and the benefit for cost, it's a very cost-effective product for this deficiency in our marketplace.
Great. I thank you very much for joining us today to talk about B12 as a deficiency, the silent epidemic, and also to give very good information about vitamin B12 and some information about optimum B12 F that's sold by Biomed. Thank you for joining us, and thank you, Harlan, for giving us this wonderful information.
Thank you, Heather.
Harlan has just given us information on vitamin B12 and some clues as to why there is a vitamin B12 deficiency as a silent epidemic. I now want to spend some time talking about Biomed's product Optimum B12 F and the benefits for your patients. So because it's called Optimum B12 F, we like to say live life to the optimum. It's a new member in our supplement line, and there are a huge number of benefits to this product. So let's review some of these. Harlan did spend some time talking about many of these points in depth, so I'm now just going to go through them as a summary. Optimum B12F is a high-potency vitamin B12 in the methylcobalamin form with folic acid. It's a quick-dissolved sublingual lozenge that tastes great. It contains methylcobalamin rather than the cyanocobalamin, which is the biologically active form of vitamin B12. Methylcobalamin offers a rapid absorption into the bloodstream, especially when you're taking it sublingually, and therefore you're bypassing the several issues of B12 absorption through the intestinal tract or the digestive tract that can be encountered when taking a typical oral cyanocobalamin B12 form. Research indicates that sublingual methylcobalamin is as effective as B12 injections, and it's suitable for vegetarians and vegans. As Harlan mentioned, B12 is sourced from animal products, and it's not found in plant materials. So it is essential that vegetarians and extremely essential that vegans take a B12 supplement on a daily basis. Studies also indicate that methylcobalamin is more effective in addressing the neurological sequelae of B12 deficiency than cyanocobalamin. And this has to do with, again, the fact that methylcobalamin is the biologically active form that the body accepts and readily uses. Cyanocobalamin needs to be converted once it's been digested and absorbed into methylcobalamin. So when taking methylcobalamin, you end up with one less step within the body in order to have it in a usable or the biologically active form. The combination of B12 and folic acid has many health benefits, and these include improved red cell blood formation. It helps prevent anemia. It boosts energy and promotes healthy sleep, has healthy functioning nervous, cardiovascular, and immune system aspects. It protects against neurological disease and aging, enhances brain health, memory, and learning, and normalizes the homocysteine levels, which decreases the risk of heart disease, heart attack, and stroke. This normalization of the homocysteine levels is one of the big aspects of what folic acid does. It's also interesting to note that signs of vitamin B12 deficiency, low energy and weakness, confusion or fuzziness, persistent sleep problems, digestive problems, hearing and vision loss, memory problems, irritability and mood swings, dizziness or lightheadedness, weak immunity, and tingling in the extremities, which can also be felt as a burning or a heaviness, especially when walking upstairs. One of the things that you may want to also know is what would a patient experience with taking B12, especially in the first few days. They'll feel more energy throughout the day. They'll have enhanced cognitive function. They'll have fewer senior moments, more balanced moods, a more deep and restful sleep, better digestion, stronger immune system, and much more. For B12F, we have the product monograph, which is available on the website and also through your medical support manager. This details all the information about the Optimum B12F product, including the uses, a description about vitamin B12 in the methylcobalamin versus cyanocobalamin form, and also information about folic acid. There are patient handout cards that are available for your office to be given to patients that have information that explains to patients what B12 is and what are the benefits of taking Optimum B12 F. Request your free handout cards today through your medical support manager or through customer service representatives. We also have sample packs that can be made available, which include 3 daily doses of the Sublingual Optimum B12 F lozenge. These lozenges have a lovely natural grape flavor and dissolve very quickly under the tongue. This is a good way for you to try the product yourself or give it to your patients so that they can try it and experience the benefits. We have a practitioner startup kit, which includes the Optimum B12 F product monograph, 6 Optimum B12 F sample packs, which contains 3 of the lozenges each, 20 patient handout cards, and a product flyer. You can call in today to get your free startup kit. Also, our website is a plethora of information, and it, again, has more information about Optimum B12 F. You can go to www.biomedicine.com. In addition, we have a web store where you can order this product directly. And finally, live life to the optimum with Optimum B12 F. Thank you very much for joining us today, and if you have questions, again, contact your medical support manager or customer service, and we'd be happy to get some of this product to you, your product sampling kit, and also allow you to live life to the optimum with Optimum B12 F. Thank you.